Welcome to the Empower Hour with Greater Nashua Mental Health. The Empower Hour will provide information and support about mental health, substance use, and behavioral health. Our goal is to share inspiring stories about transforming lives, to strike down stigma, and to encourage our community to reach out and get help when needed. Mental health is part of all of our lives. It's time we talk about it. I'm Dr. Cynthia Whitaker, President and CEO of Greater Nashua Mental Health, and it's time to get empowered. Hello, and welcome to the Empower Hour with Greater Nashua Mental Health. My name is Dr. Cynthia Whitaker, and I have the privilege of being the President and CEO at Greater Nashua Mental Health. We started this show some time ago to bring ideas and things that we do every day at the Mental Health Center to the audience, to the community, to help you be the most empowered you can be. Today, I have with us Skerry Moir, who has been with Greater Nashua Mental Health for more than 24 years. And I'm so delighted that she is here with me today to talk about child and adolescent services and specifically the DBT program. Welcome, Skerry.
Well, thank you so much, Dr. Whitaker.
Oh, you're welcome. Feel free to call me Cynthia. It's all good. So first off, you've been working in our Child, Adolescent, and Family Services program for a number of years.
True.
So tell me what you most love about working with children and adolescents.
Wow, there's a lot of things to love, but I think the biggest thing is the hope. The ability of children and adolescents to move towards change. They're so much more flexible when they're younger, and there's a lot of hope for people to recover, people to survive, people to thrive.
So I assume that means you've seen a lot of hopeful things in kids, adolescents, family make progress and over the years?
Oh, absolutely, absolutely, especially in the DBT program.
Yeah. Really makes an impact when people are able to engage in treatment and learn skills.
Mm-hmm. Absolutely.
Great. So we're throwing around this term DBT.
True.
We can start with, so what does DBT stand for?
DBT stands for Dialectical Behavior Therapy.
Okay, dialectical behavior therapy. So what is it based on? What does somebody learn when they come into a DBT program?
Oh my gosh. Okay, so this is the amazing thing about DBT is that anybody can benefit from it. And when it was originally designed by Marsha Linehan way back when, it was designed for people who engaged in a lot of self-harming behaviors, a lot of suicidal gestures, suicidal ideation, and suicide attempts. So it was designed for a specific population. However, it can be applied to many different populations. It is a evidence-based treatment that looks at combining therapy and learning skills.
So an evidence-based treatment, so that means that there's a lot of research behind it that shows it's effective with lots of different people. So Marsha Linehan's initial research was on that specific population. Yes. There's evidence that shows it works. But since then, there's been evidence about using DBT with youth, using DBT with people with substance use disorders, just using DBT in general.
And that's the beautiful thing about DBT is that when you learn the skills, you can look at them and they feel very much like commonsensical skills. They look like things that you do anyways, or things that make a lot of sense that you hadn't thought of doing. It's not a difficult skill set to learn. It's not complicated. It's not complex. And that makes it easily accessible for the people that are learning it. And when it's easily accessible, you can apply it well. And when you apply it well and you have a healthier, more fulfilling life, that's what we want to see.
Yeah, healthier, more fulfilling life.
Yeah.
I love that. So let's take a step backwards first. So why are services important for children, for teenagers? Like a lot of people think, oh, kids are just being kids, or, you know, I went through a tough time when I was a kid, and sometimes people don't fully understand why it's important for kids to have kind of a place of their own.
True. So you hear a lot of people say, well, kids are resilient. they bounce back, they get over it. And, they can look like they're bouncing back, they can look like they get over it. But if a child has been exposed to trauma early on, it rewires their brain, it influences their ability to perceive what's going on, to negotiate life in a manner that, is healthy. So services are very important so that if a repair is needed, it can happen early, while the brain is still very flexible, while the brain is still able to recreate what are the neural pathways or what have you. It's incredibly important also because children don't always look like they're having problems. And so when they don't look like they're having problems, people don't look for problems. And so they can kind of skate through until all of a sudden, boom, perhaps adolescence comes and things really start to explode. So those are pieces. You've got the fact that kids live in an environment that they don't control. Yeah. And some environments can be traumatic, can be invalidating. With the social media and the bullying and the things that goes, kids used to be able to leave school and go home and leave the bullying behind them if it was happening at school. Now it's 24/7. They can't get away from it. So there are things in our culture as the decades have gone on that have influenced children's mental health. There's the biological piece that influences it, the environmental piece. There's just so many things out there that are now creating more apparent mental health issues.
It's such a great point about kids used to be able to leave school at school. Because I think a lot of times when we talk to educators, if the home environment is chaotic, kids have the safe environment of school.
Yeah. School's predictable. School is consistent. They know exactly what to expect.
Yeah.
And if you've got a home environment that is not calm, consistent, predictable, if it is chaotic, your brain is almost constantly looking and hypervigilant to see what's going to happen next. How can I avoid this? How can I make sure this doesn't happen? How can I keep this going? And it takes a lot out of a person.
Yeah. And then flip side, if school is where somebody is experiencing something negative, in the past might have been able to separate that, go to a home environment that's validating, calm. But now, because of social media and cyberbullying, that negative impact from school can creep in.
And not creep out.
And not creep out, right? Exactly. Exactly. So you were just talking about biology, invalidating environment, a bunch of different factors coming together.
That's the DBT language. That's the language of dialectical behavior therapy. DBT is based on a biosocial theory that basically says who we are and our environment interact, and who we are, what we were born with. There are some people that are born more sensitive than others. I have 3 sisters, and we were all, raised by the same parents, went to the same schools, whatever, and we'd be sitting in front of the TV and a sad commercial would come on and I'd go, oh my gosh, that's so sad. And my sisters would say, it's just a commercial. I was just more emotionally sensitive than them. That's the way I was born. When you have someone who's emotionally sensitive, and trauma can create emotional sensitivity where none was. So if you have someone who's emotionally sensitive and they've been exposed to an invalidating environment, those two things create difficulty in regulating your emotions, difficulty in controlling your emotions. It's more like your emotions are in control of you, which can lead to really impulsive and dangerous behaviors. In teenagers, which DBT is made more for adolescents, through adulthood, teenagers, just by the nature of being teenagers, are more impulsive. The decision-making capabilities in their brain are in the frontal lobe, and that hasn't been fully formed yet. It's still growing. That's in adolescence, actually. That's the last part of the brain to really take off and grow. So as a teenager, you're already impulsive, and then if you're emotionally sensitive and you have an environment that is invalidating, that communicates to you that you shouldn't feel what you feel, you shouldn't think what you think, that your well-being isn't a priority, that you don't deserve to feel safe and valued. When those things go on together, it can really create a lot of distress.
And so when you were talking previously about the importance then of mental health services and getting kids and youth involved, it's like, okay, we want to help rewire or relearn so things don't have to continue to escalate throughout life. It's like, okay, how do we step in now? And so is that what you see kind of the DBT program as helping to do?
Yeah, one of the assumptions of DBT is that you didn't cause all of your own problems and you still need to deal with them.
You didn't cause all of your own problems,
No,
and you still need to deal with them.
Yeah.
Yeah.
And so DBT helps you learn what you can do, what you can control, what influence you can have over, because some things you don't have any influence over. You don't have any influence if somebody's not going to be willing to have a conversation with you or to problem solve with you. But you do have influence on how you decide you want to understand it, how you decide you want to deal with it, or conversely, not deal with it.
Right, right. So you specifically coordinate the DBT program for adolescents.
Yes.
At Greater Nashville Mental Health. There is also a program or group for adults. And so what makes the program for adolescents different?
So the program for adolescents involves the parents as well. Kids don't live in a bubble. And the most primary agents of change in their lives up until they're out of the house are usually their parents or their caregivers, the environment. So what we know is that asking teenagers to learn skills without their parents knowing what they're learning doesn't work as well as when a parent can sit there and say, yes, I know what skill they're learning, I can support them in it, or also I can be more patient because I see that they're doing something different and I understand why. So it's really important that the parents come or the caregivers come and learn a little bit about why the child, the teenager is like that, and what they can do to support them in using the skills or in creating an environment that allows for the skills to be able to flourish.
It's like creating a support system for the skill use,
Yeah.
right? Like you really using the support system to support the using the skills, validating the skills.
And well, the adults have to learn skills too, and they have to use the skills because it's not a one-way street.
Oh, great, yeah.
And it's such a powerful group. So there's two components of the treatment. One is the individual therapy and occasionally family therapy, and the other one is the skills group. It is not a therapeutic group. It's therapeutic in nature, but it's not group therapy. It's a skills group.
So it's a learning group.
It's a learning group, and I think I think quite often parents have a default setting when they're adolescent who might be in one of those stages where they have, quote, attitude. Of course, adults have attitude too. But they have a default setting that their kid's going to have an attitude, or kids have a default setting that their parents are going to be dismissive, so they kind of go into the conversation like that. One of the powerful things about the group is that parents will hear other kids say things, and they'll respond, and their child is looking at them like, that's what I've been trying to tell you. And also children will hear things from other adults, parents, caregivers, that they don't necessarily hear from their own. And it really allows for conversations to open up. And effective communication is a key part of DBT.
I often say there's benefit to voices hearing voices, meaning that instead of just one person talking to another person, or even sometimes the therapist, expert, doctor telling us something, there is a lot of benefit to hearing other people that are experiencing the same thing. And that's the power of group, whether it's a skills learning group or a group therapy.
Yes. And the skills that we learn or that we teach in DBT, the three main skills are distress tolerance, so how to tolerate distress without blowing things up, getting through the moment. All we have to do is get through the moment. It's not about solving the problem. Interpersonal effectiveness, about having relationships and communication and getting your needs met appropriately while keeping your self-respect. And emotion regulation, again, learning how to be more in control of your emotions than your emotions being in control of you. And those are all skills that are learned on the foundation of being able to think and act dialectically, being able to validate yourself and others, and to be able to practice mindfulness and awareness.
So being able to think dialectically is one of my favorites, but not something a lot of people know. So that is what?
Thinking dialectically means being able to hold both opposites or opposites about the same thing at the same time. So for example, you could look at this table and you could describe it as something that is pretty benign, you put things on. and I could see to something that, bruised my shins and was really painful and horrible. And it's the same table. Both those things are true about the table. They're kind of opposites, benign and causing pain. And it's the same thing with people. Somebody can be strict and firm and also gentle and nurturing in the same person. So things like opposites. If you think of yin and yang, you can't have a whole without the opposites.
Can't have a whole without the opposites. And so it's like a both and. Both
Yes.
can be true, and a lot of it's not either or.
No, it's not either or. We try and stay away from the always and never thinking the either this way or, we really try and stay away from that to allow for more balance, because that's what a dialectic does. It gives you balance. And if you're thinking or feeling or experiencing things in extremes, your behaviors, your emotions tend to be more extreme. And that's where you see things like self-injury and suicidal ideation, suicidal gestures. If you're able to think dialectically, you are able to add some balance. And when there's balance, there's less movement towards the extreme, which
Less
means
impulsivity.
less impulsivity.
Yeah.
And that's a piece of DBT that comes from, believe it or not, Buddhism,
Yeah.
Zen Buddhism.
Yeah, and the mindfulness piece of being present to what's actually occurring in front of me in my five senses, rather than what I think is occurring in my head.
Or whether what was happening in the past or what you want to have happen. It's being present and aware in the moment and not trying to avoid painful feelings, not trying to prolong pleasant. It's just in the moment.
What is.
Yeah.
What is, yeah. DBT just has a way of getting in you. And I think it's because of what you said before, like the skills are just common sense. Like, it makes sense to be present in the moment and not stuck on the past or worried about the future. It makes sense to figure out how to tolerate distress, because distress is part of life. It makes sense to work on interpersonal relationships, because interpersonal relationships are part of life. So there is a part of, like, it's just about learning good skills.
It's about learning good skills, and the therapy helps clients to see where they can put those good skills into their life. So they're learning the skills in the skills group, but then they come to therapy, and in therapy they should be tracking the behaviors that they want to track, that maybe behaviors that they want to change, behaviors that they think are a problem or that are causing problems, or sometimes they're behaviors they don't want to change and they know that they're causing problems, both and. So when they come into therapy, they're looking at those behaviors that they're tracking. And for example, if one of the behaviors is self-harm and they had an incident where they did engage in self-harm, we don't look at self-harm as the crisis. Self-harm is the coping skill that they use to deal with the crisis.
Right.
However, people are focusing on the self-harm as the crisis. They're totally missing what caused it, so that never gets rectified and it never gets addressed. And so they would, in DBT therapy, you would look at the self-harming behavior and work your way back. What happened right before. They call it behavioral chain analysis. And after you get through all the way down, even to the night before, how you slept, you can look at the series of events that led up to the self-harm and say, if you had taken your medication, do you think you would have been able to tolerate this distress more skillfully? If you had been able to communicate to your mom to get your needs met, would you have had that fight that dysregulated you? And so you look at where you could put skills in throughout the day, and if you had been able to apply those skills, would you have gotten to the point where you self-harmed the way that you did? And so that's how the skills get worked into the therapy. It's very, very powerful for anybody to see that chain, because we write it out, to see the chain and to realize, because it's very easy to compartmentalize. There was school, and then there was work, and then there was home, but not to see how it can all build up on each other. And if you didn't sleep well the night before, well, you're off to a good start, didn't have breakfast. That's another piece. There's so many different pieces that can add to your being very vulnerable to your emotions.
Yeah, I can imagine some people feeling like, oh, I just need to learn the skills, and that the group is enough. And having you explain it that way, it's like, well, yeah, learning the skills is good, and how do you apply them? How do you really have
Personalize them.
Yeah, right, exactly. Because in a group, you're talking to lots of different people at the same time. Okay, but what does this look like for you? And how could you have used it in that moment?
The group generalizes, and the therapy allows for specificity for yourself. It's like creating your own treatment specifically for you. You're not being fit into a treatment cubby. The treatment has to work around who you are.
Yeah, and I would assume there's a piece of accountability too that comes in the therapy. Like, okay, this happened and you didn't use the skills, and maybe how could you have used the skills, or how might the skills have helped in this situation? It reminds me of like we learn not just by learning, but by either reflecting on our learning or experiencing. So it's not just come listen, learn about these skills, but actually talking about how to apply them, why to apply them, how applying them could make a difference.
And that's where it becomes so powerful. And you started this conversation by asking me what I valued about what I do. And it's seeing the progress and seeing the change and seeing the improvement and seeing the teenagers and the kids feel better about themselves. And DBT, when they're doing those chain analysis, after a while, they start inputting the skills, and then they transfer it to using the skills beforehand. It's very powerful. And then they realize they have some control over what's going on, because oftentimes people that are emotionally dysregulated and go from 0 to 60 in a nanosecond take forever to ramp back down. Oftentimes they don't feel in control at all. And they feel powerless and they feel helpless, and it's easy for them to invalidate themselves and say, well, see, I can't do anything right anyway. I can't handle anything, I'm not a good person, whatever. And a lot of times that's also echoing some of the messages that they've gotten from the invalidating environment.
Right.
And invalidating environments can be intentional or unintentional. Like physical abuse, sexual abuse, things like that, that's intentional. But if you have a parent or a caregiver that's got depression, nobody sits there and says, well, I think I'm going to go to the depression store, get myself some depression, so I can't be emotionally available to my kid. That doesn't happen. But depression can make you emotionally unavailable because you are just trying to do the best that you can, and the best that you can is maybe just making sure that you get up and you get the kids out the door to go to school. That's another DBT assumption. You're doing the best that you can. And that changes. It's fluid, changes every day. And you need to do better and try harder and be more motivated to change in order to move towards that life worth living.
There's so much in what you just said. And I want to focus a little bit about the invalidating environment is often not on purpose and not intentional.
It's often unintentional.
And it makes me think of COVID, right? And
The ultimate invalidating environment.
The ultimate invalidating environment, exactly. And how many of us as parents, right, I can speak for myself in this particular instance, dealing with changes at work, figuring out remote schooling, just trying to figure out remote work, responsible for a job, there were moments where I know I was invalidating to my child more than perhaps typical. And when I think about the mental health crisis of our youth right now, I can't help but think of the stress parents were under impacting the way we showed up for our kids.
And teachers.
And teachers.
Teachers. So a lot of the invalidation got reinforced, got amplified because of the online learning and the fact that if people weren't showing up, nobody was able to go and find them. That kids were again feeling not cared about that way, disconnected. So they didn't have that consistency that they had before of school. That got blown up. And the things that were going on at home because of COVID, that got blown up. Everything got blown up. And these are their formative years. Yeah. These are the years where they're learning how to be themselves and sort of identify things that they value in life. And I heard somebody say, who worked in the school system, Sean King, you've had a conversation with her. She basically said, at that point when people were going back to school, the 9th graders were still at a 7th grade level emotionally. And then the teachers were expecting 9th graders because that's what they had gotten. And again, unintentional.
Right.
And absolutely invalidating.
Right. Yeah. I mean, to me, a validating environment is one that's compassionate, curious, empowering, allows you to show up as who you are without fear of judgment.
And holds you accountable
And holds
in a
you
way
accountable.
that is reasonable and makes sense.
Yeah.
I think that's really important too, because what Marsha Linehan noticed when she was creating this treatment was that a lot of people didn't feel like they were being held accountable. And they weren't holding themselves accountable because they just felt like it didn't matter.
Talk about the ultimate dialectic too, right? So, because I do think a lot of times people think, oh, if I validate that I'm not disciplining or I'm not holding accountable, or if I hold them accountable, I'm invalidating. But they both coexist, and in fact, boundaries and accountability show love.
When you validate, you are then more able to hold people accountable, because validation isn't agreeing with someone. It doesn't necessarily mean that you like what they say, what they're saying, doing, feeling, thinking. It means that you accept that that's where they're at. And if somebody is accepted for where they're at, again, not agreed, but accepted, they're more able to continue to have a conversation, to problem solve, to negotiate. If people aren't being heard, usually all they do is get louder. And then when they get louder, the other party gets louder. And I kind of joke around in the group, people are getting louder and they end up yelling, and who's listening? And the group members usually say, well, nobody. And I'm like, well, no, the neighbors are. But if you're being yelled at, you're not listening. You're getting ready to protect yourself. You're defending yourself. If somebody is validated and they get that people accept where they're at, they can move forward to change. If they're not being validated, it's continually fighting to be heard.
Right. And that's that everybody's doing the best they can. I validate where you're at is where you're at. And let's figure out together how to move forward. And, I'm here to help and support along the way.
And I think it's more powerful to do it with your child, with your teen, as opposed to doing it to your teen. And validation, interpersonal skills, the things that we talk about in DBT, they allow for parents to do that in a way where parents don't lose their authority or don't lose their ability to make wise decisions for their children. It really encourages and allows it to happen in a healthier way, in a way that, because the teenager buys into it as part of it, is even stronger.
Right, being on the journey together.
Yeah.
Yeah.
And this is hard because teenagers are trying to push away. That's part of their developmental task, is to sit there and push away and find their own way. So anything that you can get to be able to do something in a journey together, why not?
Yeah. And I can imagine it's validating for some teens to know, oh, adults don't have this all figured out either. Right? We're all learning skills and we can all do better.
So one of the things about the DBT group is that we, with the adults and the teens, we say, we have these rules and everybody's held to the same rules and you have to do your homework. And the homework is how you start practicing the skills, get familiar with them, start incorporating them. And a lot of times the adults will feel like, well, they're adults, they don't have to do that. Oh, no, you actually have to do the work. And they're held accountable to the same rules. And so it's kind of interesting when the adults feel like they don't have to do it because they're adults, and the teenagers see them get that addressed. I don't want to say scolded, but in a way it's just like, shame on you, come on, step up to the plate. You're part of this group too. Because the homework, when people are sharing their homework, they're sharing examples of how they used something, when it worked, when it didn't work, how to tweak it. And it's very powerful. Everybody learns from the other people's homework, sometimes more so than the talking head over here.
Right. That ability to learn from one another's lived experience. So powerful. Yeah, I love that. Like, the rules apply to everybody. I mean, we say that sometimes as a kind of parenting 101, they're house rules. And they have to apply to everybody.
Yes.
Right? Like, it just makes the playing field more equal.
And it makes the system work better.
Yeah, exactly. So tell me, when you think about the success of the program, or you think about families that have gone through the program and moved on and done really well, are there like one or two that stick out for you?
There definitely are. When people finish the group, and it's 12 weeks, and when they finish the group and they're given their certificate of completion, a lot of times they say things like, "This should be taught in schools," and the parents often say things like, "I thought I was doing this for my kid, but boy, did I get a lot out of it." So yeah, there are a couple of families that I've gotten thank you letters. I get feedback from other people saying, "Oh, somebody mentioned you and said they'd done the DBT group and it was the greatest thing." Evidence-based practices show that they're effective. We know that there's a decrease in the amount of hospitalizations, a decrease in the amount of self-harm. And I think that's something that teenagers feel good about themselves for being able to accomplish. And I think parents are incredibly grateful that their teenagers don't have to experience, and by extension, they don't have to experience, because it's heart-wrenching for parents sometimes to see their kids in that much distress and going to the hospital all the time. And
Yeah.
there are a few families. There's one family that I was over at the supermarket and I was in produce and they were on the other side and it was scary. DBT, and boom, they came and they just talked to me for like 15 minutes about all the positive changes, all the things that had happened, where the kid was now, what they were doing, how proud they were of them. Totally different than the people I remember sitting in the group. And they had a really good DBT therapist that continued the work after the skills group ended. And so I think that's a huge component.
Right. So it's not an abrupt end, but because like you said, it's those two components working together. I'm learning the skills and I'm also engaged in the therapy of how to practice and incorporate and individualize it. And that can continue after the group is done. And maybe for some people, they don't need it to continue long, but other families maybe do.
True, and so that's another difference between DBT for adults and DBT for adolescents. Adult DBT can go on for years. They can be attending the groups and doing the work for years. We don't really have that luxury with adolescents for a number of different reasons. You're trying to coordinate a lot of people's schedules, the parents, the kids, there's other children in the home, what have you, school, work. It's a little bit more difficult, so ours is truncated to 12 weeks, and I would love to have it go to 16 weeks, but not going to happen at this point.
Yeah, yeah. Well, and I can imagine there's a lot of need to follow up for some families, but that can happen kind of in the context of other therapies. And
well, we've also had people repeat it.
Yeah.
We've had parents that have had a really conflictual divorce, which is part of an invalidating environment for a kid, both attend the groups with their teenagers, or with their teenager, and we've had a parent come back with that same teenager because the teenager has asked for it, or the parent has realized it. We've had parents that have done the group together that all of a sudden the conflict really disappears from the child's view. It's still a little bit behind the scenes, but they're not exposing their teenager and the other children to the conflict and the fights that they have, and they're not fighting through their kids. And it's powerful on so many different levels. So yeah, we've had people repeat. We've had parents come through with their next child. And I think there's one family that's looking to do it with their third child because they loved what it did for the first two.
Well, something about not just learning the skill, but being on the journey together, right? Yeah. To just really support the parent or caregiver, because really any caregiver doesn't have to be the biological parent.
Oh, we've had foster parents, we've had grandparents, we've had, we've even had staff from residential.
Wow, that's powerful.
Yeah.
I mean, talk about really showing a kid we're committed to making this better.
You're important.
You're important.
You matter.
Yeah. Yeah. I was just doing some suicide prevention conversations for a group of folks last week, and one of the most powerful comments was that it's my suicidal thoughts can't kill me because my support system is strong enough, right? And sometimes we over-focus on the thoughts and the individual's experience and not enough on the support system. And I think that's what I love most about this program for adolescents, is that it says, yes, there's maybe something in the child that makes them more sensitive, the way they were wired, what they lived through as a child. And let's also look at how is the support system showing up for them and doing the best it can, because together those bring the best outcome.
Absolutely. And unfortunately, a lot of teens, their support systems, the ones that they want to go to, are other teens.
Yeah.
Because when you're a teenager, sometimes you think adults don't know anything, especially your parents. But your friends, they kind of know everything. And we know teenagers don't know everything. They can't see around the same corners that adults can. So they're driving blindly with somebody else who's leading them who doesn't know.
Right.
So when you can enhance the positive supports, the ones that are going to really be there, it's a win-win.
Yeah, the ones that are long-term and really can provide the validating environment. I love it. So our show is called the Empower Hour. So you've talked about lots of skills in DBT that I think are empowering for people, like we just talked about, right? Like that kids realize they have more control than they thought maybe they did. What about for you? What's one of the ways you feel like you empower yourself?
Oh my gosh, great question. I think the ability to provide good care and knowing that I'm part of a system that's setting that up is really empowering, that I can have that influence, that ability to move people. It makes you feel successful, competent, and empowered. It's pretty amazing. I love what I do. And I love DBT. I could talk about DBT 24/7.
It shows. It shows that you really have a lot of passion for what you do. And
It works.
Yeah.
I wouldn't have passion for it if it didn't work.
If you didn't see the hope and the work and and I think about even at a grander scale, right? You're saying, I get to do this therapy with youth and families, but there's just that sense of giving back to others and just how much that can help us as individuals.
Yeah. Well, you just made me think of the skill of contributing.
Yes, exactly. There's even a DBT skill called contributing. Exactly, right?
That where you're placing the focus on doing for somebody else, so you can short circuit the focus on yourself when you need that break from it. And it makes you feel good. It makes you feel productive. It makes you feel like you're doing something that is important.
It creates a shift of focus, right? Because where we focus is where we go.
Right. And where it shifts to is the one where you're doing for others, which is a really good feeling for most people.
Yeah, I agree with many of those parents that have been through that group. You sort of feel like, I wish we could teach these skills to everybody. And in some ways we do, but they're just packaged in such an easy to use way and understand that I think are helpful for youth, families, adults that do the adult program.
And we're trying to branch it out a little bit. We've had a couple of disordered eating groups that are DBT based that we've done over at Child, Adolescent, Family Services. That's not what I've done. I've supported them in doing it. However, we're trying to branch out. We're trying to allow for the word to get spread.
Yeah, I love that for many different reasons. But I have thoroughly enjoyed having this conversation with you about just your passion for working with kids and families and adolescents. I always say kids, but I mean youth of all ages. And specifically this program, I really is a highlight of what we get to do as a mental health center that a lot of places can't do, because it takes a lot to run this program.
And I think we're the only community mental health center that's consistently had a program for adolescents. DBT program for adolescents since the state way back when mandated it, and that was in 90
something,
90,
yeah. And I think that's our commitment to using evidence-based practices too. I mean, certainly you're trained in many of them for working with children, adolescents, and families. And I think that's part of one of the benefits of what we can offer folks. Yeah,
Absolutely. No, thank you for having me on. I have to say DBT is a favorite part of my job. And we started out, I've been here 24 plus years at the agency. I don't think I would have been if it weren't for DBT. It is so powerful.
Yeah, and just seeing the success that
Yes.
folks have had. And
I don't want to be in a job where I don't feel like I'm competent. So.
I love it. That's so great. Yeah, it makes me have a moment, right, of remembering running groups and things like that myself, like sometimes I miss those days.
I'm sure.
But I get to live through, I get to live through, right, we don't say but in DBT too often, only when we really should. I get to live through the stories that others have, I have a different role to support you in still having that success. So
Yeah, and I enjoy it when it's Monday night and we're doing DBT over at your office, and you pop in and say hi and go, yay, DBT.
Yay,
so
DBT.
I appreciate that.
Oh.
Yeah, if we didn't have the support of the agency, it would be very difficult to do this.
Yeah. I mean, there's a lot of balls to juggle with a DBT program when you're doing it well and right, between the groups and the individual therapists, and just all that happens in between, and making sure there's time for all of that.
Yeah.
So, well, I so appreciate the care and concern you've given to the program. It sounds like it's a win-win. It feeds you back, but I know it gives a lot to the community and the kids and families that have done it over the years. So thank you for what you do for the agency, for our kids, for our family, and I just appreciate it so much.
Well, you're welcome, and thank you so much for having me be part of this conversation. I really, really enjoyed it.
Oh, great. Well, thank you for watching the Empower Hour with Greater Nashville Mental Health, and here's to you living an empowered life.